Hospital staff, the people who work in any type of workplace, including hospital, are called the staff. The medical staff in British hospital belong to one of four main groups: a pre-registration house office or house office is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor. Foundation Year 1 Doctor. A senior house office is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, but the old term Senior House Officer and are still used. And SHO are still used. A specialist registrar, SPR, is a doctor who has completed the foundation program and is training in one of medical specialties. There are also some non-trained registrars. Doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is a list, one medical or clinical director, who is responsible for all of the medical staff. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor clears them, takes their medical history, and examines them. Sometime, sometime later, the registrar also sees the patients and may order investigations or tests, for example, X-rays or ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent to home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. Shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio, pager, or bleeper, a device which makes a noise when someone is trying to contact them. Nurses. Nursing grades. Nursing working in a hospital have the following grades. Student nurse. A nurse who is still in training. Staff nurse. A nurse who has completed the training course. Charge nurse. A more experienced nurse who is in charge of or responsible for for a ward or department. Nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still sometimes used for a female charge nurse. A female nurse A female nurse manager may be called matron. Um, Dr. James is talking to Sister Watkins. Support workers. The clinical support worker who has done a short course and obtained basic qualification. And the nursing auxiliary who is usually unqualified. Both assistant nursing staff. There may also be ward clerks whose duties include making sure patient notes and information are up to date and answering the telephone. Specialization. Like doctors, nursing can specialize. Like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in midwifery. The management of pregnancy and childbirth. In childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperature, pulse rates, and blood pressure, changing, dressing, giving injections, and removing sutures. Nurses now do some of the things previously reserved for doctors, such as prescribe drugs and ordering laboratory tests. More responsibility for nurses is planned as the following article demonstrates. Nurses carry out surgery in effort to cut patient waiting list. Nurses in Scotland trained to perform minor surgery have entered the operating in the operating operating theater for the first time in the effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform or carry out. An examination, an operation, and procedure, an experiment, a test, a biopsy. The procedure was performed or carried out by a nurse.